Thank you, Joy. So, hello, everyone. If you haven't met me yet, my name is Sam Miller. I'm AOPA State and Federal Advocacy Manager. And I think that a lot of people are aware of the federal work that we do for the Medicare O&P Patient-Centered Care Act. And they're also aware of kind of the state policy developments that I forward through the co-op and the state-by-state section of the O&P Almanac and the state policy forecasts that I've recently started producing. But I think something that's not as apparent on the surface level, maybe kind of the state level, like nitty-gritty advocacy efforts that AOPA is engaging with on a daily basis across the country. So this presentation is to show kind of the different ways that we interact with the policymaking process and kind of examples of the type of work that Ashley and I do every day. So I'm gonna start with kind of a very high level overview of the legislative process. It's kind of different at every level or at every state, but this is kind of a general framework. So bills are introduced in the one chamber of the legislature where they're assigned to a committee of a small number of policymakers, and they discuss the bill and they vote on it before it goes to the floor where the entire chamber discusses it and then puts it to a vote. And if it passes in the first chamber, it goes to the second chamber where the same thing happens. If any changes are made to the bill, usually it's sent back to the first chamber to say, hey, is this cool that we changed this? Does this talk all right to you? And if it passes the second chamber, it goes to the governor's desk where it can be vetoed, in which case it gets sent back to the chamber of origin where the legislature can override the veto, or it passes into law. And in some states, you need the governor to directly sign a bill, but in some states, simply not getting vetoed is what allows a bill to become a law. And it kind of just depends on where you're at. And so within this process, AOPA has several different kind of advocacy strategies that we employ. And the first one has to do with kind of the process right at the beginning. It's assisting with drafting legislation. So doing this really helps to be proactive instead of AOPA or the O&P field reacting to a bill that's passed. We can create the policy ourselves or help to create the policy ourselves. And an example of this are the study bills that are currently moving through the legislature in New York. So these direct the state's Commissioner of Health to study Medicaid O&P reimbursement. In late 2020, early 2021, members in New York decided that evidence-based kind of advocacy would be helpful to alleviate this issue. And so they consulted with AOPA on how to accomplish this legislatively. And shortly after that, the two bills were introduced, and they're currently working their way through the legislature. The Senate, the Assembly version passed to the Senate, and the Senate version is currently in the Assembly version is making its way to the Assembly. So basically, this is a very good way to be in front of possible policy challenges. And then there's also during the committee process is another place that AOPA does a lot of work. And this is important because it's one of the first hurdles that a bill has to pass over before it can kind of make it through and make its way into law. And sometimes we will testify in front of a committee, and this allows us to make our voices heard directly to the policymakers in the committee. And an example of this was in Virginia this year. These two bills are companions, actually, one in the House and one in the Senate. They require health insurers to provide coverage for prosthetic devices where previously that coverage only needed to be made available. So in January 2020, AOPA actually testified in favor of a previous version of this bill during a Labor and Commerce Committee hearing in the House. And although that bill didn't pass into law, it kind of laid the groundwork for the reintroduction of the bills in January 2022. And because those pieces of legislation or those bills were kind of well known, they moved quickly through the legislature and were passed into law in late April. So although sometimes you may not be successful on that first pass, it really helps lay the groundwork in kind of a long-term view. And so another kind of way that we can affect change in the committee stage and also in the floor stage are through kind of grassroots campaigns. So these are kind of letter writing campaigns that really show legislators that large numbers of their constituents really care about an issue. And this actually just recently happened in California with Bill AB 1892. This bill requires Medi-Cal reimbursement to be set at least 80% of Medicare, whereas before it was prohibited from exceeding 80% of Medicare. So instead of having a maximum of 80%, now it would have a minimum. And on May 23rd of this year, just about a month ago, COPA told AOPA that AB 1892 would come up to a floor vote by the end of the following day. I think it was a Monday that they told us about this, and they said, hey, this might come up for a vote on Tuesday afternoon. And we said, okay, how can we help? And so in response to that, we created a Capital Canary grassroots campaign to help have our membership in California send letters to their lawmakers. And in the end, they sent over 150 letters over the course of 2 days. And the bill, once it was on the floor, it passed in a unanimous 76-0 vote. And so it's kind of the opposite example as the previous one in Virginia, because that one was more of a long-term endeavor, and you see kind of the process moving in a kind of a slower pace. But in advocacy, you also have to be reactive to things that are going on in real time within a couple of days. So it really depends on the situation. And so for those of us who went to the policy forum, this would be familiar. A meeting with legislators is a big part of what AOPA does, because discussing these issues with policymakers, it allows for kind of that face-to-face advocacy, and it also builds relationships that allow for future collaboration and partnerships. I always like to say that you want to be the first person that an office calls when they have an O&P issue. And this is a really big step to doing that. And we helped New York kind of in this process when they were trying to increase the Medicaid fee schedule for the fiscal year 2023 budget. So earlier this year, there were several discussions between New York members and Senate and Assembly offices in the New York State Legislature to kind of underscore the importance of O&P care and adequate reimbursement rates for that care. And these talks there were several of them. A lot of it there were a lot of good action items moving forward, a lot of follow-up and making sure that these offices were listening and that they were kind of being accountable for what we had to say. And so as a result, in April 2022, we learned that the updated fee schedule increased 29 codes to 80% of Medicare, and it added 35 previously missing codes. So this is a big win. And you got to remember as well that this is kind of a negotiation process, especially with a budget, where you may say, oh, we would really think that these codes need to be added and these should be increased to this much. But, a Senate staffer might say, well, that would be great, but there's this budgetary restriction. So it's kind of an incremental process that everything builds on each other. And so we also deal with the regulatory process here at AOPA. This is, again, a very, very simplified version of the regulatory process. So usually legislation authorizes the creation of regulations. So a bill will say, the Department of Health will do this. And so in that case, the Department of Health will draft a regulation and publish a proposed version. And from there, there's a comment period where stakeholders can provide their input on the regulation, and the regulatory agency will take those kind of comments and make changes if they believe it's needed before it's finally published and then implemented by that agency. And so before regulations are formally kind of published and implemented, there are a few things that AOPA is involved in. We meet with regulators, submit rulemaking comments or letters to these agencies. And then this really helps establish your credibility as an individual or a business or an organization, because you're offering your expert opinion on the regulation in question. This was happening in North Carolina recently, where their Medicaid agency was seeking to update their policy related to cranial remolding orthoses. In March, they actually contacted us kind of out of the blue saying, hey, we'd like to make sure that our policy reflects current standards of practice. How can what input would you like to provide? What's most important for us to take into consideration? And so a few weeks later, we organized a call between the Medicaid regulators that contacted us, as well as the plagiocephaly work group that's part of AOPA's advisory board. And they were really able to offer a lot of good subject matter expertise to the Medicaid agency to provide guidance. They provided clinical data, kind of research opinions, and kind of it really helps tap into that expertise. And again, becoming that expert opinion, that trusted resource is really vital in these situations. And then after a regulation is kind of finalized and is ready to be implemented, there are also opportunities to help collaborate on that implementation. This is, again, a part of becoming a trusted resource. And in this case, this is actually an example from Illinois. Their Society of Orthotists and Prosthetists, or ISOP, they proposed to the Department of Healthcare and Family Services a few different updates to the Medicaid fee schedule. And they did this to a work group composed of senators and assembly members that were working on the budget. And in April, they received word that their proposal to add 58 codes set at 2022 Medicare minus 6% got budget approval, and that it would be completed through a partnership between the Department of Healthcare and Family Services and ISOP. So this is a great opportunity for ISOP to really have a hand in implementing a regulation in a way that is helpful to the O&P field and its patients. And again, AOPA is ready to step in and provide guidance or assistance as needed with these types of situations. And essentially, hopefully through this presentation, I can show you that AOPA has a lot to offer at the state level. There's at every stage of the regulatory and legislative process, we have kind of strategies that we can implement to really help create outcomes that are helpful to the field and to practitioners and to patients. And I also included Ashley and myself some contact information at the bottom. If you have any type of policy challenge, please let us know, because we can assist you. That's what we're here for. Does anybody have any questions?
Sam, I do. I know at the policy forum, I had brought up the North Carolina Medicaid that does not offer prosthetic coverage to people that are in SNFs. And we were going to look into how that needed to be approached. Should I reach out and contact Sherry, our contact at Medicaid, directly and introduce the idea to her about what we would like to do, or do I leave that to you guys? What's the best way to approach it?
That is a good question. I think that there is a benefit to you contacting them directly, because you're, in the state and you're bringing up something that directly affects kind of your profession. But I also think that it is helpful to have kind of the backing of an association. So that might be something that me and you and Ashley could kind of discuss and go to them together as a group almost.
Then I will email you guys later on and we can come up with a plan from there.
Absolutely, please do.
Thank you.
Anyone else? All right. Oh, Nicole.
I was just gonna say, I think this is great, Sam, and it's so wonderful to hear all of the efforts that are being done on a state-by-state basis. And for anyone who doesn't know and hasn't seen Sam's policy forecast videos, I've thoroughly enjoyed those, where Sam does kind of a breakdown every month on the new happenings state by state. And it's a really great way for people to understand what's going on. And I was curious if I know we've had a recent update in Iowa, and I was wondering if you would be interested in sharing that.
Oh yeah, I can definitely do that. So in Iowa, there's a bill, HF 2411. And essentially this allows for the replacement of prosthetic devices for workers' comp patients. In Iowa, previously there was only one device available to a worker, one replacement available to a workers' comp patient over the course of their entire lifetime. And you can imagine how that creates a problem when people's bodies change and their needs change over the course of their life. And this bill will really help to change that and make sure that people have the care that they need. And this bill was actually signed into law last night. We did a Capital Canary campaign to help it pass out of the Senate, which was very successful. And I believe it was a maybe 3/4 yes vote on that. So very, very supported in the legislature. And yeah, that's just another example. Thank you, Nicole. I appreciate that.
Yeah, definitely. That's a big success.
Oh yeah. And also definitely check out the state policy forecast. I am kind of thinking of ideas right now for this month's, and always trying to work props and special effects into it. So if you have any suggestions, please let me know.
Hi, Sam. Thanks for doing this. It's awesome. And I hope that we can somehow get more of an audience to review this, those who are interested, or at least maybe if we have a list of those who attended the policy forum, this is something we might, because it has been recorded, correct?
Yes, it has.
Yeah, or even just your PowerPoint, either one. Maybe we can get this out to that list of the registrants that we were just together, because I think they would really enjoy this. Also, we've got Aaron on the call, it looks like. Hi, Aaron. And in Minnesota, just to give you a quick update, we are in the process of revising with Minnesota's Medicaid medical assistance program. We're in the process of revising the lower limb prosthetic policy right now. There was one particular policy that struck a chord with someone in the community. And Aaron actually worked with another one of my colleagues in the field, our colleagues, and discovered it. And so we opened our Rolodex through the connections that we have at Minnesota Medicaid, and were able to get a meeting. So we had a meeting last week with the new person in charge, and then we asked if they would consider reviewing this, and it was a slam dunk meeting. Absolutely, we're going to review it. We're going to change it. We're not just going to review it. This needs to be reviewed. We're going to change it. So we're in the process of getting some materials over to her. So not only that policy, but then we asked if the policy hasn't been reviewed since 2014, of which I think several people on our small group committee were a part of way back then. So we asked if we could review the entire lower limb policy, not just this particular piece. And she said, yes, let's do that together now. And then she asked us if we could help her create an upper limb policy. So I just wanted to stress that, to those on the call and maybe to our extended community, when we're working together, Aaron's coming from Wiggle Your Toes, and he's coming from the actual, the consumer bringing to our attention an issue, and then going back with the O&P facility, and then working with, I work with the state association here with Minnesota Society of Orthotists, Prosthetists, and Pet Orthotists. And although since COVID, we are really just on an on-call basis, when we work together, these things, we really can effectuate change. I will reach out to AOPA as well if we need any other policy guidelines. We are fortunate that we have Kimberly and myself, Kimberly Hansen from Autobach, and myself, both board members from AOPA, who have knowledge of what we do here. So, but it is to AOPA's credit that we have knowledge that what is going on in the other states and how to do it, and hopefully to help also be an example to others about how to effectuate this change.
Absolutely. Yeah, I think having that knowledge of other states is really helpful for kind of policy diffusion purposes, because a lot of times these kind of go state by state. And also, your example is a great way to show that it's not always, oh, this policy's in place, well, this is just going to affect our business now. It's if you know the right people, if you're able to contact the people that will make these decisions, you can make great changes. Well, if there aren't any more questions, I would like to announce we had a few different candidates for Advocate of the Month, but none of them are here, if I'm being honest with y'all. But I think that I don't know what to do. If I'm being honest with y'all, I had 3. It was,
Roll it over to next month and give 2 out
Ooh.
next month.
There we go.
idea. That's a great idea, because I had a few. I know that so Glenn Matsushima was going to be our winner. He was involved in the California campaign, and he also is helping to form an association in Colorado. So that's been really, really good stuff, and I wanted to share that. But I mean, even though he's not here, I think it's really helpful to recognize that, and hopefully he's at the next one so I can give it to him then. But we'll see how that goes.
Isn't he with us in spirit?
Yeah, I mean, that's the thing. I figured he would be here. But no, I appreciate everyone listening to this presentation. I know that it kind of gets down into the weeds, but I think it's important that people know that we're working for you at the state level all across the country.
Sam, how soon can we get these slides? Because I'd like to look at them a little bit closer.
Yeah, I can send that out to you after this, and then I can also kind of work with Joy and Nicole to see how best we can provide this for our kind of members at large or the policy forum attendees.
Great, super. And it would be great to send at least the slide deck to the board as well.
Okay,
Thank
definitely.
you.
Absolutely. This is great. Sam, I was curious, after listening to Terry and Aaron, and just the powerhouse that they represent in the Midwest, I'm curious, and for anyone on this call as well, the history of potentially having like regional leadership or, creating a model around that. I know the Amputee Coalition has, done their lead advocate program, and they're kind of moving towards a more regional leadership model. But just curious if that was of interest to anyone, or Sam, if you have experience with that. It's just something that kind of sparked my thoughts as we were talking.
That is an interesting question. I think that we have the state reps network in place right now, and I think that creating kind of a regionalized kind of version of that, like kind of subgroups within that, might be an option to kind of change that one around a little bit. But yeah, it's definitely an interesting idea.
Nicole, it's interesting that you bring that up, because I know the Academy has chapters. So it has localized chapters. Here we have the Northern Plains chapter is in our region, and there's 4 states involved in that. So great idea. Food for thought.
Definitely. That's great.
Well, everyone, are there any other comments, questions? All right. Well, hearing none, I can give you all a couple minutes back in your day. I really appreciate you taking the time to stop by today, and I hope to see you at Advocacy and Action webinars in the future.
Thank you.
Thank you, Sam.
Thank you,
Thanks,
Sam.
Sam.
Nicely